I see what my patients are spending money on, and some of it genuinely hurts me, not because the products are dangerous, but because the money is real and the results are not. Today, I'm gonna go through 10 things I would not spend another dollar on with my actual clinical reasoning for each one. Some of these are gonna be controversial. Some of them are things you've been buying for years. I'm giving you the honest version either way. Hi, I'm Dr. Amina, a triple board certified dermatologist. I have been treating patients for 16 years and I've been in private practice for 12 years. I care deeply about people getting real results without unnecessary spending. If you're new here, welcome. Please subscribe. Let's get into it. 1, an expensive cleanser. So this one is simple math. A cleanser is on your skin for 30 to 60 seconds before you rinse it off. Whatever actives are in it, the fancy peptides, the luxe botanical extracts, the proprietary complex, they're going straight down the drain. The skin doesn't have enough contact time to absorb any of it. A gentle, fragrance-free drugstore cleanser does exactly the same job as a $60 one. It removes oil, debris, and sunscreen without stripping the barrier. I love brands like CeraVe, Vanicream, La Roche-Posay, Cetaphil. These are all excellent. Save your money for the products that actually stay on your skin. If you are spending $60 on a cleanser, you are paying for the experience of washing your face, not for skincare results. 2, harsh physical scrubs. St. Ives apricot scrubs. Anything with large, jagged, irregular particles, this category has a fundamental design problem. These particles can create micro tears in your skin barrier rather than gently buffing the surface. Those micro tears trigger inflammation, they can accelerate barrier breakdown, and they can worsen acne in people already prone to it. The apricot kernel specifically has an irregular, sharp shape under a microscope. Like, there's litigation about this, and the data supports the concern. If you want to exfoliate, I recommend using a chemical exfoliant like AHA, which is like glycolic acid or lactic acid for dry skin, and a BHA like salicylic acid for oily or acne-prone skin. Or if you prefer a physical option, choose one with smooth, round, uniform particles like jojoba beads. The shape of the particle is what determines whether it's helping or hurting. 3, eye creams with no proven actives. Now, I am not anti-eye cream. I am anti-paying $40 for moisturizer in a tiny jar with a tiny applicator and a large marketing budget. An eye cream earns its place in your routine when it contains ingredients that actually address your concern. So for wrinkles and firmness, you wanna look for things like retinol, peptides, vitamin C, caffeine in meaningful concentrations, meaning that they appear near the top of the ingredient list, not buried at the bottom as a label claim. For things like dark circles, you wanna look for ingredients like vitamin K, vitamin C, niacinamide, and caffeine. These are ingredients that I like to look for. And if you want to calm puffiness, I do like caffeine, or I like those eye creams that have like a cooling applicator tip. There are also certain peptides that can help with this. There's something called Isoryl, which is acetyl tetrapeptide 5, and this can help with puffiness. If the first 5 ingredients are water, glycerin, emollients with nothing active in sight, you're buying a moisturizer at eye cream prices. Your regular moisturizer applied carefully to the orbital area will do the same job. 4, cellulite creams. There are no topical creams that can remove cellulite. I hate to break it to you. And this is not a controversial statement in dermatology. It's just not how cellulite works. Cellulite is very structural. It's caused by fibrous bands called septa that connect the skin to the underlying muscle. So it pulls the skin downward, creating that characteristic dimple appearance, and no amount of caffeine, retinol, or firming complex applied topically can release those physical bands. What topicals can do is temporarily hydrate and plump the skin, which can reduce some of the visual contrast slightly, but that's it. If cellulite is genuinely bothering you and you want real results, the treatments that address the actual structure are in office. There's things like subcision. There's a brand for it called Avel or Veli, where they're literally snipping the bands. There's also radiofrequency microneedling, which can tighten the skin somewhat. These procedures are a little bit of a different conversation than a $30 cream that promises to reshape your thighs. The cellulite cream is not doing what the label says. The label knows this. 5, oxidized vitamin C serum. If your vitamin C serum has turned orange or brown, it means that it's oxidized, meaning the L-ascorbic acid has degraded and lost the majority of its efficacy. You're now applying a slightly acidic, slightly sticky liquid to your face and calling it vitamin C. It's not vitamin C. L-ascorbic acid is inherently unstable. It degrades with exposure to light, to air, to heat. And to get the most out of it, you really need to make sure that you're storing it in a cool, dark place. You have to make sure that the cap is on tight and use it within a few months of opening it. If you find yourself cycling through oxidized bottles before you finish them, I would switch to a more stable vitamin C derivative like THD ascorbate, ascorbyl glucoside, or magnesium ascorbyl phosphate. These are more stable, less irritating, and still effective for brightening and antioxidant protection. You will waste less and get more consistent results. 6. Detox Teas. I want to remind you that your liver and your kidneys are your detox organs. They process waste continuously around the clock without any assistance from a tea. No beverage changes that equation. Many products sold as detox teas or cleanse teas contain senna, which is a stimulant laxative. Senna causes bowel movements, and that is not detoxification. That is a laxative. And if used regularly, senna can cause like electrolyte imbalances, dependence, and sometimes GI damage. Some detox teas have also been found to interact with medications, so watch out. The wellness industry makes a lot of money on the concept of detoxing your body. Your body already does this. It does not need help from a $40 tea. Senna tea is a laxative. Detox tea is a laxative with better packaging and a higher price point. 7. Expensive SPF that you don't reapply. The most effective sunscreen is the one that you actually use correctly. And correct use means reapplication, especially if you're outdoors every 2 hours, after swimming, after sweating. If you're buying a $50 luxury SPF and applying it once at 8 a.m. and considering your sun protection handled for the day, you are probably overpaying for partial protection. A drugstore SPF 50 that you reapply consistently will outperform a premium SPF that you apply once and forget every single time. My recommendation, spend less on the SPF itself and invest money into having multiple formats available. You can have a bottle for the morning and like a powder or a stick that's easier for midday application over makeup, and then a travel size for your bag. If you make it accessible, it will increase your compliance, and compliance is the whole game when it comes to sun protection. 8. Collagen supplements that are not hydrolyzed. The collagen supplements are having a major moment, and for good reason. The evidence for hydrolyzed collagen peptides on skin elasticity, hydration, and joint support is definitely promising. There's a lot going on out there, but the keyword is hydrolyzed. Regular collagen, non-hydrolyzed, consists of large protein molecules that your digestive system breaks down into amino acids before absorption, and these amino acids then compete with every other amino acid from your diet for uptake. There's no guarantee that they end up in your skin. Hydrolyzed collagen peptides are pre-broken down into smaller chains, di and tripeptides that are absorbed more directly and have demonstrated better bioavailability to skin tissue in clinical studies. If your collagen supplement doesn't say hydrolyzed or collagen peptides on the label, then you may be spending significant money on a supplement that isn't delivering the results the research actually supports. 9. Toners with no active. A toner is really not a mandatory step. It became a fixture in skincare routines decades ago when cleansers were harsher and left skin pH disrupted. The toner then rebalanced the skin before the next step. But now we have modern gentle cleansers and they don't create that problem, which means a toner is only earning its place if it contains something that actively benefits your skin. So I say if you want to use a toner, look for something that has like niacinamide or AHA or BHA or something with hyaluronic acid or another kind of proven active. You want it to be a genuinely useful addition to your routine. A toner that is essentially just fragrant water like rose water or a dilute mix of humectants with nothing else, that's a product that you're buying because of how it feels in the moment, not because of what it's doing to your skin. So please check your ingredient list or the label. 10. Body lotion applied to dry skin. But this one isn't about the product, actually, it's about when you apply it. If you are toweling completely dry after your shower and then applying body lotion, you're missing most of the benefit. Moisturizers work by sealing water into the skin. So if there's no water there to seal in, they're just sitting on the surface, providing a temporary occlusive effect. Apply your body lotion within 2 to 3 minutes of stepping out of the shower while your skin is still slightly damp. That timing allows the lotion to lock the moisture from your shower rather than working from zero. If your skin is very dry or crepey, layer a body oil underneath or mix a few drops into your lotion. The application window matters as much as the product you choose, and this is completely free to fix. None of these are about being cheap with your skincare. They're about spending on what actually works. Gentle cleanser over expensive cleanser. Reapplied drugstore SPF over a luxury one used once. Hydrolyzed collagen over the non-hydrolyzed version. Toners that actually do something. The difference is information, not budget. Please save this and send it to somebody you know who's spending money on any of these. It might save them more than a few $100s a year. And everything I recommend as alternatives is linked in the description below. And remember, a like really does help this reach more people. And if you haven't subscribed yet, this is what I do here. Thank you so much for watching, and I will see you in the next one.